So the next thing we're going to do is take our gown and outer gloves off. Now, for the purposes of this demonstration, we have to try and reuse our PPE. So Megan's going to untie it at this point. However, if you're in a real clinical situation, what you would do is you'd pull it from the front. So here and here, pull it down away from you. Now, what you almost have to remember is that this is full of oil and you don't want to get it on your scrubs at all. So you have to do it as far away from you as possible. And you roll your gown and your outer gloves into a ball. Now, as you're rolling your gown down, what you'll find is that your outer gloves will just come off naturally with it, like that. The most important thing is to say is nobody's going to do it perfectly each time, but just take your time, keep yourself safe. The most important thing to remember is that you want to keep any nasty bugs that are on your PPE away from you. So just take your time and just do it as far away from you as possible. So at this point, you take your gown and your outer pair of gloves off in the bin. You gel your gloves again, and then you leave your doffing area. Now, the term doffing area will vary between all the different places that you work in. So critical care areas, some of them have rooms for doffing, and others just have areas. So again, if you're in these places, please keep an eye on what they do clinically, and if you've got any concerns or you're not quite sure what to do, please just ask somebody, because they'll be able to tell you exactly what you need to do. There's also lots of signposting around, so please be aware of all that. So you've left your doffing area, and now we need to remove everything from the neck up. So you've come out of the doffing area, you gel your hands again. And then you remove your visor. Again, you don't want to just be whipping it off so you're spreading coronavirus all over. You need to be very careful as you're taking it off and putting it either in the bin or into wash. So a lot of the goggles and the visors at the minute are being reused. Different areas do it differently, as you would imagine, but so please just pay attention to what they do. A lot of it is washing it in claw clean and then rinsing it and leaving it to dry. At this point, you gel your hands again and you remove your glasses if you're wearing them. Your glasses need to go into a sink ready for you to wash with soap and water, or a Clinell wipe, the little ones. Usually in the doffing areas, there's Clinell wipes readily available for you to use. Once you've done that, you remove your mask. You remove the bottom elastic first over your head, and this prevents it from flipping up. You then remove your top, leaning over and straight into the bin. Then you gel your hands and you get rid of your gloves into the bin. And then you go and wash your hands with soap and water. Remember to wash your hands up until your elbow if you can fit them in the sink.